Hello, hi everyone. Today I would like to share with you some information about COVID, which is really a recent information. So make sure that you watch this video up to end. So things that needs more attention at this time is that there are some medical conditions that needs more attention because if you have that medical conditions, obviously the chance of having a severe illness of the COVID may increase. So therefore, to take care of yourself, you have to watch some of the video, some of the cases that needs attention. So in case if you have it, so make sure that you have to protect yourself in a good way from COVID. So the adults of any age with certain underlying medical conditions are at increased risk for a severe illness from the virus that causes COVID-19. So what does that mean, a severe illness? Well, a severe illness is normally defined by hospitalization, or if you are admitted to ICU, or and if there is any mechanical ventilation, and finally there might be death. So that is a severe illness. So if you have such kind of medical conditions with the adult, then in that case you may have another chance to a severe illness that may lead to death or to hospitalization, or it could be an admission to ICU. So what are these diseases? So the first one is cancer. So if there is if you have a cancer, so the risk of having a severe illness is high. So make sure that you have to protect yourself in a good way. And another one is the chronic kidney disease. So if you have any cases with a kidney diseases, you have to protect yourself. That's also another, and it has to be chronic normally. And the other one is the chronic obstructive pulmonary disease. It could be like bronchitis or any pulmonary cases which are which leads like obstructive cases. So in that case, you have to also protect yourself from COVID. And the other one is the Down syndrome. Normally, Down syndrome is also increasing the chance for a severe illness to have a COVID. So what does it mean, Down syndrome? Well, it is just a genetic disorder which is caused by the presence of all or a part of a said copy of the chromosome to anyone, and it is usually associated with physical growth delay. So if you have the Down syndrome, obviously there will be a physical growth delay, or there might be a mild to moderate intellectual disability and the characters of facial features. So even their average of the IQ of the young adult with the Down syndrome is 50, which is equivalent to the mental ability of an 8 or a 9 years old. So what else? The other one is any heart conditions, especially heart failure, chronic artery disease, or cardiomyopathy. So these are also that needs attention, and any immunocompromised status, which is in a weakened immune system from a solid organ transplant. So if someone did already a transplant, so obviously his immune system is becoming weakened. So in that case, it is called immunocompromised state. So those people are really at risk of having a severe illness. So you have to protect yourself. If you are recently or if you are made a transplant, organ transplant, so take care of. The other one is the obesity, yeah, obese people, and the severe obesity also, and the pregnancy also. And the other one is a sickle cell diseases. So I'm just explaining only some of the cases that needs more attention. The other one is they are really yeah, they are very clear, so you can know it easily. So the other one is sickle cell disease. What is a sickle cell disease? It's a group of blood disorder typically inherited from a parent from a person's parentis. So the most common type is known as a sickle cell anemia. So it results in an abnormality in oxygen carrying protein called hemoglobin, which is found in the red blood cells. So this leads to a rigid and a sickle-like shape under certain circumstances. So problems in sickle cell disease typically begin around 5 to 6 months of age. So anyway, if you have such kind of problems already, you know it. So take care of yourself from COVID. And smoking is normally it is not good enough for most of the more for most diseases. It is really a risk factor, so it's also a risk for the COVID as well. And type 2 diabetics mellitus diabetic patients, so you have to also protect. So I hope you got some information. This is very recent, and I got this information from CDC. And if you have such kind of cases, make sure that to protect yourself from COVID, keep your distance, and wear a mask and disinfect your hands. So that is the common ways to protect from COVID, and you have to be far from any crowded area. So with this, I wind down my lecture for today, and if you like it, just subscribe, and you'll get to know more cases.